Today in this video we are going to learn about the semi-solid dosage forms, that is ointments. So what are these semi-solid dosage forms means? Semi-solid dosage forms are mainly meant for external applications, example ointments, creams, jellies, paste like that. So the suppositories are also included in this category, although these are unit dosage forms. But today we will learn about the ointments first. Okay. So what are these ointments means? So the ointments are the semi-solid preparations meant for external application to the skin or mucous membrane. So they usually contains a medicament or medicaments dissolved, suspended or emulsified in a ointment base. So they may contain a suitable antimicrobial preservatives included in the preparation. So the ointments are mainly used as a protectives or emollients for the skin. Okay. So that is about the ointment definition. So that means ointments are the semi-solid preparations intended for external application to the skin or mucous membrane. So they are mainly used for therapeutic, protective or cosmetic purposes, and typically they have an oily or a greasy basis in them. Okay. So let us see the ideal characteristics of a ointment first. So they should be smooth and non-irritating. As these are applied to the skin, they should be smooth in texture. Okay. And they should spread easily on the skin, and they should be stable both chemically and physically. It should be a stable one, and they should not cause allergic reactions. Okay. And they should retain the drug at the site of application. Okay. These are all the various ideal characteristics of an ointment here. Let us see the classification of the ointments. So these ointments are classified according to the so many categories, based on the therapeutic action, based on the penetration rate. So let us see first classification of the ointments based on the penetration. Okay. So before going to see the classification about this, let us see the anatomy of the skin. As this ointment is gets penetrated into the various layers of the skin actually. So let us see the anatomy of the skin first. Okay. So the skin is the largest organ of the human body. That is the common point, we all know about that. So it acts as a protective barrier and plays a role in the sensation, temperature regulation, immunity and vitamin D synthesis. Okay. There are so many layers are there in the skin. What are those means? The first outermost layer is the epidermal layer. Okay, this is a thin vascular layer that there is no supply of blood to this layer. Okay, it is mainly composed of keratinized stratified squamous epithelium. Okay, the function of this layer is mainly for the protection, waterproofing and skin tone. Okay, that is the outermost layer. So what we are observing, the superficial skin, so that is the epidermal layer. Okay. So there are sub layers of the epidermis are there, that is a stratum basilae, stratum spinosum, stratum granulosum, stratum lucidium, stratum corneum. Okay, so these are all the sub layers of the epidermis. Okay, and second layer is the dermis. This is the middle layer. Okay, this is some sort of thick vascular connective tissue layer. It provides strength, elasticity and nutrient supply to the epidermis. Okay, it mainly contains a rich supply of blood vessels, nerve endings, hair follicles, sweat glands and sebaceous glands. So all these are present in the dermal layer. Okay, and third layer is the hypodermis, that is the subcutaneous tissue. Okay, so it is made of loose connective tissues and a fat, that is adipose tissue. Okay, the function of this layer is mainly for the insulation, shock absorption and energy storage. Okay, It mainly anchors the skin to muscles and bones. Okay, so these are all the various layers of the skin. That is, first layer is the epidermis, second one is dermis, and third one is the hypodermis. Okay, so now we get some sort of idea about this uh, layers of the skin. Now we will see how the ointment gets penetrate into the various layers of the skin. Okay, so that is the classification of the ointments based on the penetration rate. Okay, first type of ointment is epidermic ointment. Okay, it mainly produce action on the surface of the skin, that is the epidermis. So it will shows action up to epidermis only. Okay, the purpose of this ointment is for protective, antiseptic or soothing. So it mainly penetrates below the outer skin. Okay, example of this type of ointment is zinc oxide ointment. It is used in the diaper rashes. And second one is the calamine ointment. It is used for soothing the skin. And second type of ointment is the endodermic ointments. It produces action up to the deeper layers of the skin, that is the dermis. Up to the dermis it will show action. So the purpose of this ointment is for local therapeutic effect within the skin layers. Okay, it mainly penetrates up to skin layers, that is absorbed into the skin layers but do not enter bloodstreams. Okay, example, methyl salicylate ointments used for the muscle pain and diclofenac ointment used in the joint pains. Okay, and third one is the diadermic ointments. It produce action into the systemic circulation. Okay, these are designed to be absorbed to the skin into the systemic circulation. The purpose of this diadermic ointment is for systemic effects or deep tissue effects. So they mainly penetrates through the skin into the blood. Okay, example, nitroglycerin ointment for angina and hormonal ointments like estrogen or testosterone preparations. Okay, let us summarize all the types of ointments. First one is epidermic ointment. It shows action to the skin layers and penetrates. There is no penetration at all. It will show action on the surface of the skin, and example is zinc oxide and calamine ointments. And second one is endodermic ointments. It will show action within the skin layers. There is a partial penetration rate, and example for this is diclofenac and methyl salicylate ointments. And third one is the diadermic ointments. They will show action into the systemic circulation. Okay, the penetration rate is high, and for this example is nitroglycerin and hormonal creams. Okay, and next type of ointment classification based on the therapeutic use. So ointments can be classified into the various types depending on the intended medical or therapeutic actions. Okay, there's so many types are there, like antibiotic ointments, antiseptic ointments, antifungal ointments, anti-inflammatory ointments, antipruritic ointments, astringent ointments, keratolytic ointments, counter-irritant ointments, ointments used for dandruff treatments, and ointments for psoriasis treatments, parasiticidal ointments. So ointments based on the therapeutic action. First type of ointment is the antimicrobial ointment. They are mainly used to prevent or treat the infections caused by microorganisms like bacteria, fungi and viruses. The ointment used for to treat the bacterial infections, such ointments are called antibacterial ointments. So that is, it will use to kill or inhibit the bacterial growth. Example, neomycin, bacitracin, mupirocin. Okay, and second one is antifungal ointment. They are mainly used to inhibit or kill the fungal organisms. Example, clotrimazole, ketoconazole, miconazole. And third one is antiviral ointments. They are mainly used to inhibit the virus replications on the skin. Example, acyclovir ointment. And second type of ointments is anti-inflammatory ointments. They are mainly used to reduce the inflammation, redness and swelling. Again, these are of two types, that is steroidal anti-inflammatory ointments and non-steroidal anti-inflammatory ointments, that is NSAIDs. Okay, first one is steroidal anti-inflammatory ointments. They mainly contain corticosteroids. Example, hydrocortisone, betamethasone, clobetasol. And second is non-steroidal anti-inflammatory ointments. They mainly provides a local pain relief and reduces a swelling. Example, diclofenac, ibuprofen ointments. And third one is the analgesic and counter-irritant ointments. They are mainly used to relieve the pain, usually by irritating the skin surface to distinct from deeper pains. Okay. For these examples are the local anesthetic ointments and counter-irritant ointments. So the counter-irritant ointments produces some sort of mild inflammation to relieve that deeper pain. Example, methyl salicylate, menthol. And for local anesthetic ointments, they mainly blocks the nerve endings conduction locally and produces its action. Example, lidocaine ointment, pilocarpine. Next one is astringent ointments. They mainly causes contraction of the skin tissues, useful in weeping wounds or hemorrhoids. Okay. Example, zinc oxide, calamine, tannic acid, aluminum acetate, like that. And fifth one is the emollient and protective ointments. They are mainly used to soften, moisturize and protect dry or damaged skins. Okay, general type of ointments. Okay. First one is emollients. They mainly smoothens and hydrates the skin. Example, white soft paraffin, lanolin, petroleum jellies, like that. And second one is protectives. They mainly forms a barrier to the skin from irritants or moisture. Example, zinc oxide ointment for diaper rashes. Okay. And next type of ointment is keratolytic ointments. They are mainly used to remove the thickened skins, that is keratin, especially in warts, corns and psoriasis. Example, salicylic acid, urea and lactic acids. Okay. And next one is the hormonal ointments. They mainly delivers the hormones transdermally for local or systemic effects. Example for this is estrogen, progesterone, testosterone, like that. And next one is antipruritic ointments. They are mainly used to relieve the itching. Example for this is calamine, menthol, diphenhydramines. And next one is the anti-psoriatic ointments. They are mainly used especially for the treatment of psoriasis. Example, coal tar dyes, pyranol and calcipotriols. And next one is anti-acne ointments. They mainly reduces the acne by acting on the bacteria, inflammation or oily productions. Example, benzoyl peroxides, clindamycins. Okay, next one is hemorrhoidal ointments. They are mainly used to relieve the swelling, itching and pains of hemorrhoids. Example, witch hazel, lidocaine. And next one is the anti-scabitic and antipediculosis ointments. They are mainly used for treating the scabies and lice. Example, permethrins and sulfur ointments. And next one is the wound healing ointments. They mainly promotes the faster healing of minor cuts, burns and ulcers. Example, silver sulfadizine honey based ointments. So up to now what you covered means introduction to the ointment. So what is the ointment, what are the various layers of the skin, and the classification of the ointments based on the penetration and the therapeutic use. And then in the next video we are going to learn about the selection of the dermatological vehicles. Okay, there are so many ointment bases are available nowadays in the market. We will see how to choose the best one. Okay, and next one is the ointment preparation. Okay, thank you for watching this video. Please subscribe to our channel for more videos and click on the bell icon for to get the notification. Thank you.